Good morning, Exercise Science. This will be the fourth lecture for this chapter, chapter 12 on the cardiovascular system. And looking at the notes just before I started this recording, probably going to do one more lecture. I was going to try to jam everything into this last one, but I'd rather take my time since this is a very important chapter, get through some of the material, and then conclude the chapter probably with one more lecture, middle of the week or so. So looking at the long term, obviously this is Monday, probably going to want to have some sort of assessment by the weekend, and then we'll talk about what we'll do in the following couple of weeks, leading towards a final. I'll give you a schedule tomorrow, or this morning rather, will come out. So let's look at the cardiovascular system. By the way, good answers talking about the pattern of circulation through the heart. I know that my notes are pretty well laid out, and I have no problem with you sitting there referring to them as you go through it. But the big thing that I need you to understand about the heart is how it works. When we're looking at the heart, the right side of the heart is for pumping low oxygen blood to the lungs, so it can pick up oxygen and drop off its carbon dioxide by gas exchange and by diffusion. And the left side of the heart is to pump high oxygen blood to the entire body. That's it. If you understand that much, and you have that understanding of the heart and its function and the four chambers and what they do, you're in very good shape. We'll get into a lot more detail, obviously, but that is a good start. That's a good place to be. Once you're there, everything else is just adding details. So, looking at today's material, I want to talk about the three types of vessels. We have arteries, capillaries, and veins. You've probably heard of those before, and maybe you already know exactly what they do or what their functions are. Arteries' job are to carry blood away from the heart. Arteries carry blood away. They typically are thick-walled. They're muscular. There's a smooth muscle layer that makes up the external structure of the vessel itself. And they do that because they have to withstand a great amount of pressure. 70 some times a minute, they're going to get a nice burst of blood through them, and they need to deliver that blood to the tissues. Understand this about arteries. Arteries range in size from bigger than your thumb to microscopic. What defines an artery and what differentiates it from a capillary, which we're going to get to next, arteries are not capable of exchange. Their job is to carry blood to a tissue. They deliver it. Blood or arteries supply. You'll hear me say that word a lot probably in the next lecture. Arteries supply blood to tissues and cells. They take it there. They're a highway without an exit. That's their job. They deliver the blood. So once they get there, they'll start branching off into what are called capillary beds. And what you need to know about capillaries is the capillaries, if I were to strip every single type of tissue from your body, everything that you are outside of capillaries, you'd still be able to recognize, if you looked around the classroom, everybody's faces, their features, their outlines. Your body is a big, vast network, a dense network of capillaries. So many, in fact, and I don't want you to visualize them in a linear fashion, but if we had the ability, because it's more like a three-dimensional spider web, if we had the ability to take each of those capillaries and lay them out straight, close to 100,000 miles worth of capillaries in your body, enough times to circle the globe 4 times. So again, understand how diffuse this network is and how important it is. Why is it like that? Because you have to get to every single cell with blood supply. And how do you do that? With capillaries. So once the arteries narrow and they turn into single-celled walled vessels, they are now capillaries. That is what defines a capillary. Capillaries are capable of allowing materials to pass through their walls into the surrounding tissue, and vice versa. Materials can pass into them, with the exclusion of red blood cells. If we're losing red blood cells even through a capillary, then you're by definition bleeding. That's what bleeding is when red blood cells escape the vessels. So even at their narrowest, even when capillaries are only a red blood cell thick, and that's as small as they get, the red blood cells remain in circulation. So the rest of the materials, the things that are dissolved in the plasma, they have the ability to move through the walls by exchange mechanisms. Exchange, I have underlined up on the board here, not underlined, but with some exclamation points after it. Exchange is an important thing to understand. What does that mean? It means that the bloodstream is going to exchange materials with the cells, and the cells are going to exchange materials with the bloodstream. So you have things passing back and forth, like carbon dioxide leaving the cells going into the bloodstream to get carried back to the right side of the heart. You have oxygen passing out of the bloodstream into the cells so they can perform cellular respiration. All the nutrients, all the wastes do that. They pass back and forth that way by different transport mechanisms. The word that sums it all up, though, is exchange. We talked about gas exchange in the lungs last lecture. Once the capillaries are done doing their job, they will start getting larger and larger. They'll become more than one cell thick. At that point, they are veins. The job of a vein is to carry blood back to the heart. So it takes blood to the heart. The word that I use to describe veins, when we talk about their overall function, is that they drain tissues. They pull blood out of tissues and return it to the heart. Other places in the body as well, but for our purposes right now, we'll just talk about the heart. The veins are relatively thin-walled, whereas the arteries are thick-walled. They don't have to be. There's not a lot of pressure in there. So the veins' job, again, is to retrieve blood from the tissues, from the capillary beds, and return it to the heart. That's a good summary of these three vessels. Now, some things that we talk about heart function and circulatory function, systole and diastole. Systole or systolic is your heart contracting or beating. It's your heart working. It's the heart doing what it does, which is contract. Right? In between beats, the heart rests a little bit, just a fraction of a second, but it does rest. That's called the diastolic phase or diastole. We talk about that with blood pressure. We evaluate systolic pressure in the arteries and diastolic pressure in the arteries. Which one's, obviously systolic is going to be greater because that's the heart beating. Diastolic is going to be less, but we use that to evaluate someone's overall health. Velocity, blood pressure, peripheral resistance are all things that refer to the blood's movement through the vessels, whether it be arteries, capillaries, or veins. Velocity is the speed, point A to point B, how long does it take to get there. Blood pressure is the amount of pressure exerted on the walls by the blood itself. That's a lot of things can dictate your blood pressure. Volume of blood, the amount of fluid in the blood. In fact, when we treat blood pressure, one of the first things that they typically do will give a person what's called a water pill or diuretic, something that's going to make them lose some water through their kidneys to reduce that volume of blood and reduce, hopefully, the pressure without putting them on other types of medications. And then we have what's called peripheral resistance. That's the resistance of blood flow to the periphery of the vessel, the inside periphery of the vessel, which is going to slow the blood down because it's going to be interacting with that tissue. So that's another factor we look at. Velocity of the three vessels. Where's it greatest? It's greatest in the arteries. Where's it least? Now, common sense would tell you that it would be least in the veins because it's going to pass through the arteries, the capillaries, and veins. If I roll a ball down on a floor, it's going to slow down the further away it gets. This is not the case, though, with our blood vessels. Velocity is going to obviously be greatest in the arteries. Once it gets to the capillaries, it slows way down, though, just because of how diffuse it is, how again, that three-dimensional spider web. Once it exits the capillaries and goes into the veins, again, logic would tell you that it would be slowest in the veins, but it's not. It speeds up a little bit, and that's just because there's less peripheral resistance. The veins are bigger, so it allows the blood to flow a little bit. It doesn't speed up greatly. It's not this tremendous increase in velocity of blood flow, which you'll see here in a moment. We'll talk about some of the challenges of getting blood back to the heart through the venous system. But it does speed up just a little bit. So the slowest velocity of blood is in the capillaries. Now, venous return. How do we get blood back to the heart? Now, logic again would tell you that the pressure of the heartbeat or the contractions of the heartbeat should be enough to push the blood around the body and push it back to the heart. It's not. It's not sufficient to return the blood to the heart. Now, and blood that is draining out of your head, out of your face, your neck, your shoulders, that's going to have a gravity assist. That's going to move back easily through the superior vena cava. Not going to be a problem unless you stand on your head. All right. So, but if you're standing in an upright position or sitting like I am right now, it's not going to be an issue. Now, the blood that's in my feet, when I stand up, it creates another physiological challenge for me that a little bit different than when I was standing. Each case is still a physiological challenge. I have to get the blood back from my feet all the way to my heart. I'm going against gravity. I'm going against a lot of other things as well. But the gravity's the big deal in this point, in this case. So how do we get blood back? There are a number of different ways. Obviously, the heart contraction is going to be one of those. It is involved in pushing the blood back to the heart, to the veins. Some other things, the contractions of the skeletal muscles in the legs. When you'll see a patient that is having issues with their circulation, a lot of times you'll see swelling in the extremities, especially the ankles and the feet. That's because this venous return, the body's having a difficult time doing that. So what we would want to do with that patient is stimulate their skeletal muscles in their legs through exercise, through massage, just through stretching, to squeeze, literally squeezes the blood back towards the heart. So when those skeletal muscles contract, when I'm walking, when I'm sitting here, just a normal posture, there's enough contraction in them and it helps to squeeze the blood back. Now, a logical question to ask at this point would be, Mr. Spano, why doesn't it squeeze it in both directions? Why don't I squeeze it not only towards the heart, but also back towards the foot? Because the veins that are beneath the heart have valves. The valves look kind of like this. Sorry, it's the best I can do right now. And if you look at it in the notes, I think there's some illustrations in there too, and there'll be plenty of pictures on the internet if you want to look as well. They're one-way doors. So when the blood's pumping from underneath my fingers, they open up, all right? In between, when the blood starts to move backwards, think of a heartbeat or something like that, these are going to close. They're like cups, and they close like this, and they trap the blood from falling backwards. And they don't open again until the heart beats the next time. So it's kind of like your blood's climbing a ladder. So not only is the heartbeat involved in this, but also the squeezing of the skeletal muscles. Pushes them open, and they snap shut, keep the blood from flowing backwards. So it's kind of a step up, step up, step up as the blood goes back to the heart. Another factor that will help return the blood to the heart, especially as we get into the thoracic cavity, is the pressure increase that occurs when you take in a breath. So when I take in a breath, I'm going to increase the pressure in my thoracic cavity, and that actually helps to squeeze the little bit, or the blood that's in the vena cava, especially the inferior vena cava, back into the right atrium. And also, as the blood leaves the right atrium, it creates a little bit of a vacuum force, because the blood pressure right when you get to the heart in the right atrium is close to 0/0. So that vacuum force, that fluid leaving, the blood leaving the right atrium, creates a little bit of a vacuum or a little bit of pull, and it helps to pull the rest of the blood into the heart. So there are a number of factors that are going to help get the blood back to the heart through the venous system. If you have any questions, again, always send me emails, messages through Google Classroom. I'm checking a few times a day, as I mentioned before. And as I mentioned, I'll have some plans up for you for the week. And next lecture, we'll finish up the chapter and have an assessment sometime probably later in the week. Have a good day.